Get ready for Sci Friday.
Misinformation. It is bad for science. Welcome to Sci Friday from Skywatch TV. I'm Derek Gilbert.
We are about to tell you a story, boys and girls, of what may only be misinformation, but certainly appears to be disinformation, intentional. Now, we'll see what happens with that. Even the writer of one of the major articles about this study that we're about to discuss has said in his piece that if it is discovered that this was actually done, that everything that this company claims to have managed to coordinate worldwide is true, then he will publicly apologize. The gentleman I'm speaking about, who wrote this piece, and there are many, many pieces on the internet about this right now, James Todaro, he is a physician at Columbia, and he is questioning the authenticity of a couple of studies that were published, one at the New England Journal of Medicine and the other one at the Lancet. These are very prestigious publications.
Right. If you get something published in those magazines or in those journals, it's considered peer-reviewed. It's been vetted, and you can trust it.
A gold standard.
Right. Right. You can trust it as true.
True. Absolutely. Well, the study in question, the studies published in both of them, had to do with the efficacy and safety of hydroxychloroquine.
Oh, that's been kind of a football now. During COVID-19, there are those, including President Trump, who took it as a preventative. He'd been in contact, or at least in an area where somebody who tested positive had been, and so he was taking it along with zinc as sort of a...
as a preventative, because there are some claims that it can be used for prevention.
Right.
So, this study at the Lancet was released on May 22nd. Since then, because this study concludes that it is extremely dangerous to administer hydroxychloroquine to COVID-19 patients. So, the study came out saying that over 96,000 patients were included in the data.
How many again?
96,032 patients.
Okay, all right.
Of which 14,888 were in treatment groups. So it was looking at those who were on the treatment versus those who were not on the treatment. One of the problems arose within a day or two because there were other scientists. Again, this is the nature of true peer-reviewed studies. They have to be reproducible. People need to see the data. They need to be able to look under the hood at the engine to see how you came up with your conclusions. That's why these studies have long, here are the methods and materials. This is how we did it. This is how we assigned the various groups. And so you know how to replicate it. The problem is, none of the numbers made sense. Some of the numbers included deaths in patients that were far more in overall number than the total number of patients, period, at the time.
More people dead than were actually
sick. Also, there was a question regarding the number of African hospitals that were theoretically, supposedly, allegedly enrolled in this data set. The company involved is called Surgisphere. Now again, it may turn out, once this is all investigated, that Surgisphere can provide the raw data. Currently, they are sort of hemming and hawing about it. So when we come back, I'm going to tell you some things about Surgisphere that will definitely cause you to go, huh? And if I were to put on my conspiracy theory hat,
yes,
and I've got one, if I were to put that on, I would wonder if there weren't some reason for denying any efficacy to hydroxychloroquine. In fact, saying not only does it not work, it kills people. Because it's an inexpensive drug.
It is a cheap drug, and that's something that the president has mentioned before. And yet this company, Surgisphere, had peer-reviewed papers published in The Lancet and the New England Journal of Medicine that said, oh, no, this is very dangerous to give to people infected with coronavirus. And yet you mentioned problems with the study itself, but
the numbers don't add up.
There are questions about the company itself.
There are questions about the company that really, really make you want to put that hat on. Since these studies came out, both The Lancet and the New England Journal of Medicine have published letters on their websites saying they are very concerned about the data in these studies as well, and they're looking into it. There is a call that's been signed by over 200 physicians, scientists, who want to see the data. So far, Surgisphere is saying that I'm sorry, we can't do that because we have, well, we've said that we wouldn't reveal any data that might compromise patient confidentiality. Now, mind you, supposedly nearly 700 hospitals worldwide are part of their software system for collating data on patient outcomes.
Yeah. They claim they have one of the largest and fastest hospital databases in the world.
Here's the thing. If you go to their websites, you can't find anything that was there prior to, say, September of last year. That doesn't give them time to install software and train people at nearly 700 hospitals worldwide.
And you wonder how they would market themselves without any kind of online presence.
And how they would afford it when the, what is the organization that values Dun & Bradstreet?
Dun & Bradstreet.
Dun & Bradstreet. They are saying that the value of this company is under $50,000. Yes. Now, mind you, it would take $1 to $3 million per hospital to go there, train the personnel, install the software, make sure your IT people locally and with the company, Surgisphere, were communicating, liaising, and making sure that every regulation in every country was being observed.
Okay, so you'd think that they would have to have a market capitalization somewhere north of $1 billion.
Oh, yeah.
At least.
At least $500 million.
And what was it, like under 50,000?
Now, if you go to their, and I wish I could say that I'd found that information out, but no, it's you can find it online at many of these. One of the Guardian did a wonderful piece on this. But if you take a look, you'll find out that the address for this company is a familiar sounding address to anyone who lives in Chicago, because it happens to be the John Hancock building.
That's pricey real estate right there. That's what they call the Miracle Mile.
Yes.
North Michigan Avenue.
I looked on the leasing site for John Hancock, and you can start at $500 per month, but you can bet that that's a teeny-weeny broom closet, and you get no support, nothing. You don't get anything. You're lucky if you get a phone. But for under that amount, less than that amount,
so there was
you
about
can get a
115
virtual office.
Yeah, $115 a month, which is somebody who agrees to answer a phone for you.
Pay premiums to have someone forward your mail, answer your phones. Yeah.
Yeah. Yeah, this is bizarre. The LinkedIn page for the company has fewer than 100 followers as of last week.
Fewer than 5 employees.
Yeah, they had 6 as of last week, but that was changed last Wednesday to 3. One of whom was a science fiction author, and another who was apparently an adult model.
The point is, none of these people are IT professionals.
That's correct.
They're all involved with PR. And in fact, one of the pages for the software platform itself that Surgisphere supposedly sells, when you went to the sign up here or more information, it took you to a site that sold sort of like Bitcoin.
Cryptocurrency.
Cryptocurrency, thank you very much.
Right, yeah, just a WordPress template. In other words, they took a template for a website but didn't finish filling it out.
Didn't finish filling it out. It's since been changed, by the way.
Yeah, this is what I'm sure that the archive.org, the Wayback Machine will have,
the Wayback Machine has nothing on this company.
Really?
Nothing. In fact, I saved that image in my photos. I'm hoping that it's here. Here it is. Sorry, this URL has been excluded from the Wayback Machine.
That's bizarre.
Now, does that mean that there is nothing there? Not necessarily, because you can. I don't know how you do it, but you opt out of being included. So if it was opted out, why was that done? And who is really behind this? Is it Dr. Desai, who is the gentleman listed as the CEO?
Mm-hmm.
And he's also the main author. And by the way, when you read the one of the articles that I was reading, the blog post where this gentleman did a lot of research and tried to find out everything he could about. He should be a journalist, an investigative journalist. He discovered quite a number of things about this company, and I've lost my train of thought.
Oh, well, I think the bottom line here, though, is
get me back on the track.
the bottom line is that we've seen that what we have here are two prestigious medical journals, the Lancet and the New England Journal of Medicine, that published a study at the end of May that said that the anti-malarial drug hydroxychloroquine was associated with a higher mortality rate in COVID-19 patients. This study was authored by a company that appears to be a shell or a front for somebody without a real office, without a real staff, without real access to the databases that they claim to have.
Claims that are really difficult to back up. I remembered what I was about to say. Dr. Desai, on his LinkedIn profile, lists a number of awards that he's been given. Well, the gentleman that I was quoting a few minutes ago, great investigative journalist and MD, he dug into that, and he, for the prizes and the year that the Dr. Desai said he won an award, this gentleman says, no, these are the actual winners because you can find it on the award website. So he's not, he says it is possible that perhaps Dr. Desai presented a paper there, and, CVs are often augmented.
Sure.
So if this is what's going on, I'm praying that Dr. Desai is involved in this company without any intent to mislead.
That they put him up there as a front man. Would you be the public face of this for what we're doing? Well, let's pray that that's true.
I do pray that's true.
But the bigger questions here, I think, are rather important. First of all, how is it that whoever wrote this study, which, as you said, clearly has issues because the numbers just don't make sense.
No.
Why did they write it? To discredit hydroxychloroquine.
Yes, because all the studies were stopped.
Exactly.
As soon as it came out.
Yeah, because the World Health Organization and other governments saw these studies in these prestigious journals and said, oh, okay, this is dangerous. We're not going to give this to anyone else. We're not, stop all studies.
And that was the right response based on these studies.
Assuming that the study was correct. But they weren't. So how did the Lancet and the New England Journal of Medicine get fooled? Who's behind those studies and putting out this bogus information? Who benefits? Qui bene? Always the important question. Follow the money. And what other studies published by the New England Journal of Medicine, the Lancet, and other peer-reviewed academic journals are likewise bogus?
Yes, well, that is the question. And that's the heart of good science is, again, it needs to be reproducible.
Right.
And sadly, not all studies that are just assumed, okay, this says this, therefore I'm going to assume it's right. They're not always replicated.
No, that's...
It's as if no one wants to try anymore.
This is Sci Friday from Skywatch TV.